Prescription medications, use and abuse in behavioral health settings. The focus of this presentation is prescription medications that are vulnerable to abuse and their use in behavioral health settings.
San Mateo County Behavioral Health and Recovery Services implemented a new medication policy. We will be reviewing the policy in the presentation and discussing its implications. The policy states that consumers are not to be denied services because they are taking prescribed medication, regardless of type. Client treatment plans will address treatment needs of persons on prescription medications. Treatment staff will consult with prescribing physicians whenever possible. There are some notations important about the medication policy. Any perceived problems with prescribed medications are to be dealt with as a clinical issue and done in a clinical manner. The prescribing physician should be involved whenever possible. Each treatment provider shall develop procedures to ensure that the policy is adhered to.
It's helpful for programs to adopt operational procedures to implement the guidelines. These procedures may include policies and guidelines that are non-discriminatory and that address all clients treated regardless of their prescription medications. The procedures may further include how to physically handle prescription medication in a safe and responsible manner. There are obvious differences in AOD providers that may only store medications and mental health providers that may have different regulations concerning the handling of prescription medications. The procedures should also include how to engage clients around prescription medications and how to create an accepting culture to ensure the minimization of any stigma concerning prescription medications.
There are perhaps special challenges in compliance with the policy in substance abuse recovery programs. Some of these challenges include that non-behavioral health recovery service physicians' training and understanding of addiction may be different. Also, that non-behavioral health and recovery services physicians, their willingness to discuss issues with their patients, your clients. Non-behavioral health and recovery services physicians' willingness to partner with treatment staff, the abuse potential of prescription medications, and the milieu issues involved in a treatment program. To further discuss the challenges working with physicians who may be prescribing these medications, there have been several surveys done of physicians, and they reveal that many feel it is difficult to discuss prescription drug abuse and addiction with their patients. This may present unique challenges in working with these prescribing physicians. When staff find that physicians are difficult to engage, things that providers may do are to consult with the administrative leadership of BHRS, to consult with behavioral health and recovery services consultants, to utilize staff with personal or professional relationships to the contact, attempt different ways to contact the physician, and refer for a second opinion.
Of course, prescription drug abuse is widespread. More than 2.4 million Americans reported current use of prescription drugs for non-medical purposes in 2010. We're going to be discussing three classes of prescription drugs that are especially vulnerable to abuse. These include opiates prescribed to treat pain, stimulants prescribed to treat attention deficit hyperactivity disorder and narcolepsy, and CNS depressants prescribed to treat both anxiety and insomnia.
While these drugs can be abused, they also may serve as an important clinical tool. Many persons with co-occurring disorders benefit from psychotropic medications. Some, but not all, of these medications do have abuse potential. Treatment outcomes are improved when collaboration between primary and behavioral health care providers is ongoing.
It is important to be aware of the limits of our scope of practice for each professional in the field. Addiction to prescribed medication is common, but recovery and mental health services staff must refer and defer for medical decisions to medical practitioners. Furthermore, recovery and mental health services staff must refer or defer to physicians for medical advice.
There are certain clients that seem to be more vulnerable to abuse of prescription medication. There are overrepresented groups in treatment programs. More women than men abuse and are addicted to prescribed medications, especially tranquilizers and sedatives. More adolescent girls, 1 in 10, than adolescent boys, 1 in 13, are abusing prescription medications. A significant cause for concern is older people who are in recovery. Older people are more vulnerable because they receive many more prescriptions. And the abuse of prescription drugs is the most common form of drug abuse among the elderly.
There are red flags for abuse. A common aphorism in the field is that no one ever loses a prescription for high blood pressure medication. This speaks to the manipulation for drugs that are vulnerable to abuse. Multiple physicians prescribing medications for a single patient is also a red flag, as is an over-reliance on emergency rooms for prescriptions. Persons in mental health or substance abuse treatment programs may have real and almost disabling pain. When pain is not addressed and drug-seeking behavior occurs in the pursuit of legitimate pain relief, this is often referred to as pseudo-addiction. So when severe pain is not addressed with enough or appropriate medication, pseudo-addiction may occur. Drugs that alleviate pain and that can be abused are generally the prescription narcotics. So pseudo-addiction was first described in 1989 to describe an iatrogenic condition in people with severe pain. And an iatrogenic illness is when adverse health effects result from medical treatment. It's caused by the insufficient treatment of real pain, and it can be present in persons with a true addictive disorder or not. It can be difficult to distinguish between drug-seeking behavior for legitimate pain relief and drug-seeking behavior for abuse. Many signs or symptoms are or may be identical. These include moaning or other demonstrations of pain, pain complaints that seem excessive, clock watching for the next dose, or repeated requests for medication. All of these can be either addiction-related behavior or pain-related behavior or pain-alleviating related behavior. Of course, there are differences over time. Distinguishing between seeking pain relief and drug-seeking behavior is difficult, but in pseudo-addiction the condition improves with the provision of adequate pain relief. In addiction, the condition rarely improves. There is almost never enough medication. And in pseudo-addiction, the client's painful condition is not believed but interpreted as addictive or as drug-seeking behavior associated with addiction.
Many individuals in behavioral health services have histories of abuse and trauma. Repeated trauma in the face of powerlessness is devastating to the human condition. There is a high correlation between addiction and trauma, and these individuals may benefit from medication. The consequences of trauma can be debilitating and may result in psychological disorders that are treatable with medication.
Drugs that treat attention deficit disorder are generally the stimulants. And attention deficit hyperactivity disorder does not always go away when people transition from child to adulthood. The National Institute of Mental Health estimates that 3 to 5% of children are thought to have the disorder, and that 1/3 to half of adults retain the symptoms and diagnosis in adulthood. Adult treatment for ADHD frequently parallels childhood treatment, and prescription medication assists in helping to focus the concentration and energy of adults as it does in children. There are no medical withdrawal risks with drugs used to treat ADHD.
Medications used to treat anxiety are also vulnerable to abuse and dependence. There is potential for abuse, so some physicians will prefer to treat anxiety in the milieu setting. These medications are used to treat anxiety disorders and are also used for detoxification. They are physically addictive. Clients cannot stop the use of these medications without a taper schedule.
The culture of a behavioral health treatment program concerning the use of prescription drugs is critical to client success. It's very important to create a culture of acceptance. Persons who use antipsychotic drugs or major tranquilizers for thought disorders or antidepressants for depression are only now being fully accepted in recovery culture and recovery communities. And persons on prescribed drugs susceptible to abuse continue to be stigmatized in substance abuse recovery and treatment settings. Stigma associated with prescription medication can unnecessarily interfere with recovery. Stigma ignored represents a treatment opportunity lost. Furthermore, each co-occurring disorder may need to be treated independently, and so multiple prescriptions may need to be prescribed. It's important to develop an acknowledgement that there is nothing contradictory about being in recovery or recovery services and being on a medication with abuse potential. Peers in treatment, and especially in recovery programs, should not be allowed to stigmatize persons on prescribed medications. Furthermore, staff must be comfortable in role modeling non-stigmatizing and accepting attitudes. It's critical that staff understand that treatment is individualized for each client or patient in treatment and convey this to the client peer group. However, of course, we want to be aware of how clients are doing with their prescribed medications, and we want to remain aware of potentially dangerous behaviors or conditions in the client population.
There are several issues that deserve special consideration regarding medication in behavioral health treatment programs. These include the abuse of medication, the sale of medication, sharing of medication between clients, and missing medication in a treatment program. A primary concern then is responsibility among the treatment staff. Staff must make certain that the right medication gets to the right person, and also be certain that the doctor's orders are followed.
Storing controlled medications requires extra precaution. Each program may need to decide whether all controlled medications are counted during each shift change. Although time-consuming, it may serve to protect staff from both temptation as well as false allegations of impropriety. So controlled medications are best treated like cash. Persons receiving or assuming responsibility for controlled medications want to be certain what they are taking responsibility for. And there must be procedures for ensuring accountability, and these procedures must be site or program specific.
Programs implementing these policies need to consider medication storage and chain of responsibility, how to adapt the culture so as to eliminate stigma, the establishment of processes for liaisoning with prescribing physicians, changing the culture of a treatment program, taking time, and unanimous buy-in all the way from the top of the leadership down to all line staff.
The keys to success, in summary, are first, The creating a positive culture, an accepting culture, and non-stigmatizing culture in the treatment program.
Another key to success is the knowledge base of the staff. There are clear reasons for clients to be prescribed medication with abuse potential, and this may occur even while these clients are participating in a recovery treatment program. Prescription medications are a clinical intervention to treat specific conditions. Prescription medications have the potential to help clients be maintained in treatment.
The prescribing physician should be a part of the treatment team whenever necessary, and the prescribing physician is able to problem solve with staff and hear staff concerns.
We often have limited and at times even wrong ideas about what works. Diverse clients require a diverse bag of clinical tools. Psychiatric diagnoses and pain may best be treated with prescription medications. We as providers have a responsibility to help everyone succeed in behavioral health services.